If you're a parent and you're trying to figure out if your child has ADHD and needs treatment, don't be this guy. Don't run around and try and see if your child needs to gargle medications before you ask your primary provider 10 simple questions. Number one, how do you know who needs treatment? Look, let's just be honest. Just because your kid is struggling in school or in baseball or at grandma and grandpa's house, just because they're annoying and frustrating, it doesn't necessarily mean that they need a medication to fix that. Let's be honest. Kids are annoying. We don't use a medication to stomp out annoyance. We treat kids with ADHD for one primary reason, and because they're impaired. It doesn't take much to confirm the diagnostic criteria for ADHD. If you take me to a medical conference and you put me in the front row and you give me 4 pots of Sanka coffee, like the old instant coffee, super gross, but also strangely delicious. And you put me there, and then the main speaker for the conference speaks in a language that I don't understand. Guess what I'm gonna look like I have? ADHD. Well, the joke's on you. I actually do have ADHD and was on a bunch of medicines to treat this. And you can go check out other videos and I'll explain it. But in this video, you need to ask your primary provider, well, how do you know my child needs treatment? It's more than the chicken dance of, does he have problems sitting? Does he get out of his seat? Does he get in trouble? The question you have to ask your primary care provider is, do you think my child is impaired? Listen, the hallmark of ADHD is not diagnostic criteria, it's sadness. It's sadness. These kids are sad. Their lives are hard. They're not successful in any environment most of the time, and the only information they get about themselves is they're bad, they're wrong, and they need to be different. That is what impairment looks like. Impairment looks like an abject dumpster fire in every environment. The first question you have to ask your provider is, do you think my child is impaired? If they don't know the answer, or if they don't ask the question or know what you mean, find a new provider. Number 2, how do you know if this medication is safe for my child, right? Just because they make a medication and just because children have mouths, it doesn't mean that you should put medicine in their mouths. Quick spoiler alert. Physicians don't drive around in white vans past playgrounds thinking, man, I sure wish we could stop and put a bunch of medicine in those kids' mouths. We don't want to treat kids. I don't want to put a kid on a medication. Do I do it all the time? Yes, because I see a lot of kids who are impaired. But just because you can do something doesn't mean you should. Is your child safe to take a medication? So let's talk about it. What does that mean? Do they have cardiac issues? Has there been someone in your family who's died from sudden death? Does your child have an arrhythmia, a long QT syndrome, or something of the like? Is there a family history of complex congenital heart disease? Young people who just died. Does your child have a complex congenital heart disease? Are they followed by a cardiologist? These medications increase blood pressure, they can increase pulse, and oftentimes, if I'm gonna start one of these medications on a kid with a cardiac history, it doesn't mean that I can't put them on a medicine, but it means I gotta make some phone calls first. Does your provider think about that? How big is your child? Because, hey, listen, if you watched any of my other videos, you put a kid on an ADHD medicine, guess what they're gonna do with their weight? It's gonna go boop, 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 down. It's gonna go down, not because it strips away their weight, it's because they're not hungry. It's not that they just drop weight, it's usually that they don't grow in the same trajectory and they reset their growth profile. If your kid is less than the 5th percentile on the growth chart, that 5th percentile kid is gonna become a 0 percentile kid real quick. Does your child have seizures? Because sometimes starting an ADHD medicine, a stimulant medication like Concerta or Adderall, will lower the seizure threshold. So you need to talk to the neurology group. You need to understand that it's possible that your child could have breakthrough seizure. What other medications is your child taking? Do you need to run a check to make sure that these medications, Adderall, Ritalin, Concerta, whatever, aren't going to interact with the medications that your child is already taking as a general rule? If your child has a long list of comorbidities, they see more than 1 or 2 subspecialists, you probably want to fact check what you're doing before you do it. Lastly, how does your child sleep? Did you know that most children diagnosed with ADHD already don't sleep well? And guess what these medications do? They can interfere with the sleep-wake cycle. If your child doesn't go to bed in a timely manner, they're up till 11, 12, or 1 o'clock, and they're not gorking on media, which you should stop doing, by the way, then it's possible that starting them on an ADHD medicine is only going to make their sleep-related difficulties worse. And if that's the case, you have to know going in that that could be a problem, and it could really just make their focus and attention during the school day even worse than it already is. So ask your provider, how do you know that this medication is safe for my child? Not for any child, not for all the children, for your child. Number 3, what else could be going on? Listen, this is an important question because ADHD is a descriptive diagnosis. It doesn't necessarily tell you what's happening at all levels of your child's system. There is a medical thought process that is required in order to adequately and comprehensively assess an individual for ADHD. Things like obstructive sleep apnea. Do they have big tonsils? Do they wake up sweaty and scared at night? Are they restless when they sleep? The covers are everywhere. They're in strange positions when they wake up. They're falling asleep at 10 in the morning. They may have a sleep-wake cycle disorder. They may have obstructive sleep apnea. Maybe they've got constipation, right? So they have pain and bloating and abdominal distension, and it causes them great distress, and they're unable to sit, listen, and focus during the school day because of discomfort. Maybe they have hearing or vision deficits. Maybe they have a dental problem. Maybe they have a poorness of fit in the school system. There's a young, very well-meaning teacher who's doing the very best that they can, but they're not able to tolerate the deviances that often are experienced in individuals who struggle to focus. Maybe there's a lot of tension and stress in the classroom. Maybe it's a classroom that's not run well, and the disorganization and chaos distract your child. There have been many times I've seen children miraculously cured of ADHD, just going from one school year to the next because the classroom is run differently. Maybe your child needs additional assessments or interventions like IEP supports or a 504 plan. Maybe there's social stressors. Grandma's dying on a hospice bed in the family's room. There's a divorce. There's a new baby in the home. The family's just moved. Maybe there's a dog. Maybe there's the death of a dog. Maybe there's a comorbid condition that's occurring, like anxiety or depression or oppositional behaviors, or an underlying learning difficulty or disability that makes it virtually impossible for the child to sit, listen, and focus on the task at hand. What else should be going on? This is an important question that you need to ask your primary care provider before settling on a descriptive diagnosis that doesn't plumb the depths of what could actually be occurring. Number 4, what medications do you want to start with and why? This is an important question to ask your provider. Why do they pick Ritalin? Why do they pick Strattera? Why do they pick Adderall or Vyvanse or Concerta? Understand the logic. Younger kids tend to do better on shorter acting medications as a proof of concept. You don't necessarily want to use a long acting medicine in a child who hasn't been around for a very long time. If your provider is recommending a long-acting strategy, understand why. See if you can get to the bottom of why they chose one medication strategy over another. Maybe it's because they've had a negative experience with these medications, maybe because they know something about the availability of these medications at the pharmacy, or maybe they went to a conference and learned one thing about ADHD and it's the medicine they're recommending. Find out why they're recommending the medication. Why stimulants? Why not non-stimulants like Qelbree or Strattera? Or why not natural interventions like omega-3 fatty acids or a Mediterranean diet or removing dyes and preservatives from foods? Ask your provider if they can tell you why they're making the choices that they're making. Number 5, ask your provider how they're determining the starter dose. As a general rule, if a child is drug naive, meaning they've never been on these kinds of medications before, you're going to start as low as possible, but it depends on a number of factors, such as the age of the child and how big they are. As a general rule, you're going to start low and go slow. But then another set of questions is, how are these medications dosed in general? And that's a more complicated question. You have to understand that these medications, depending on which one your child is prescribed, have a top end dose. There's a dose that you shall not go past. As an example, if it's Concerta, it's 72 milligrams, sometimes 108, but usually 72 milligrams. If it's Adderall XR, it's usually 40 milligrams. If it's Vyvanse, it's up to 70 milligrams. But dose adjustments can also be a little complex. As long as you keep in mind the top end dose, what I tell families is, listen, if you're on a 5 milligram dose of short-acting Ritalin, I say to families, look, if this is Harry Potter, he doesn't even know he's a wizard yet. Okay, so people need to know where they're at in the story. So as you think about dosing, as you think about dose manipulation, and you have those conversations with your primary care provider, you absolutely have to get a sense from them about what their strategy is and how many moves you have to make before you have to abandon ship to something else. In the middle, as long as you know what the top end dose is, okay, and you don't exceed it, there's a number of dose adjustments that you can make in the middle. And typically how I do that is by doing the math. Now, these are not strictly weight-based medications, meaning you don't have to necessarily follow that rule. But as a general rule, a therapeutic dose of a stimulant medication like Adderall or Concerta or Vyvanse, typically you're looking at a 1 to 1.5 milligrams per kilogram per day as a maintenance, okay? As long as that dose doesn't exceed the maximum dose, there's discernible benefit and manageable side effects, then you're likely on a medication strategy that's effective for the long term. Question number 6. What are the side effects of this medication? You should ask your provider that question. And again, if they can't answer these questions, save yourself the heartache and the struggle and keep moving on down the road. ADHD is a problem, okay? It's a struggle. You want interventions and you want them now, but I promise you, if your provider can't answer these questions, they're not going to be able to answer the more difficult ones, which we're going to discuss in a minute. What are the side effects? Well, I'll tell you, when families ask me about side effects, I say, listen, you're going to think I got a crystal ball. You're going to think old Dr. Noble's Nostradamus out here, because I'm going to tell you straight, there are 3 primary side effects. There's a lot more, and that's beyond the scope of this video, but there are 3 primary side effects. The first of which is appetite suppression, which we have already discussed. Your child will eat less when the medication is effective. That does not mean that they will eat less all day and night. It means that while the medication is effective, they're not going to eat as much as they normally would, which means they're likely going to plateau in their weight or potentially lose weight. So if it's a 4-hour medicine, you take it at 8, you're not going to eat that snack at 10. You might eat lunch, or you might just pick at it, but you'll be hungry by 2. If it's a 12-hour medicine, you might not eat much for lunch, you might not eat an afternoon snack, but by 4 or 5 o'clock, you'll probably eat or think about eating. You may eat dinner, you may eat a second dinner. So your appetite is going to go down. Number 2, sleep onset difficulties, which we've just discussed. If you don't know this, you better be reminded right now. Do not give that medication outside of the prescribed dosing timing. So what that means is, if it's a long-acting medicine, you got until like 8 o'clock in the morning to decide, okay? You got to give it before then, 8, 9 o'clock maybe, because it's typically a 12-hour medicine, so do the math. You can't give it at noon and hope for the best. It won't work. Just because you're going to a wedding, well, he's not sleeping that night, I'll tell you that. If it's a short-acting medicine, you might be able to give it at 2 or 3 o'clock at the latest, because 4 to 6 hours is what you'd expect, depending on how your child metabolizes this medication. So do the math. But if you give it in the right time frame, I wouldn't expect you to have a ton of trouble, but you could have some. The third most common side effect is irritability. It's not uncommon for children when they're coming off these medications to just get a little irritable, either when they're on the medication or when the medication is coming off. When they come off the medication, guess what happens? They get more hyperactive and impulsive, right? It takes time for them to return to their baseline. So you have to anticipate that the medications can irritate things. These medications, they're not peace bringers. They don't bring peace, they bring the sword, right? They rev up the car, and you're thinking, well, why on earth is that happening? How can that be good for a child who's already revved up? Let me explain. If you've ever ridden in a boat, when you go slow in a boat, you feel the waves a lot more. But when you speed up in the boat rises above the waves and you start to cut through the water, and it's a little bit scarier, it's a little bit more intense, but it's a little smoother. That's what ADHD medications do. They hit the gas in the boat, you rise above the waves, and you go, 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 but you're going fast. Things are tense. You're burning through a lot of calories. It gets a little more dicey up there, okay? So you have to understand that these medications are not designed to bring peace. They bring the sword. They focus your child. They take a scattered laser light show, okay? And they make it a focused laser beam that cuts through buildings. So when that medication, that intervention wears off, it's fair to assume that they're going to have a little bit of step off in terms of their focus and attention. It's not necessarily bad or wrong, but you have to know that's going to happen. Don't call your provider and say, hey, guess what? They're out of control in the evening, because your provider, if they're good, is going to say, how were they during the day? And you're going to say, oh, he did fantastic. She was amazing. She's getting all A's, and everyone's can't even believe what's happening. And then your provider's going to say, we don't treat evening. We don't treat bedtime per se with an ADHD specific medication. So you have to understand that is the natural distribution of the effect of this medication, and you just need to chill out. If your primary provider can't articulate what I just said, find a new one. Number 7, how soon can you expect to see benefits from these medications? If you're watching this video, you've been on a wait list, you've struggled, you're probably still on a wait list waiting to have these things evaluated, and you don't need to wait longer to know when you're going to see benefits. As a general rule, the children that I endeavor to treat are children whose lives are fairly problematic without a medical intervention. Now, I hope never to use a medication for a child, but if I do, it's because things are really, really bad. And in prescribing a medication, you deserve to know from your provider How soon can I expect to see benefits from these medications? As a general rule, ADHD medications work very quickly. If the dose is appropriate and the medication is correct, you can expect to see benefits within 30 to 60 minutes from taking the dose. Your child's brain comes literally online. Okay. Now, again, I'm not advocating for a pharmacologic approach for every child with ADHD or focus and attention difficulties, but if you're going to take a medicine, you should know from your provider how quickly these medications work. And if they can't answer that question, you might want to keep looking. Number 8, what will you do when the medication doesn't work? Listen, it's easy. It's easy to start a medicine. Okay, it's easy to clarify a diagnosis. Once you go through the necessary steps, you figure out a treatment plan and everybody's happy until the treatment plan doesn't work. The reason why fields like mine are in demand, the reason why mental health providers around the country are so busy, it's not because people don't know what ADHD looks like, okay? And it's not because they don't know what treatment options are available. It's what happens when the treatment options don't work, or the side effects outweigh the benefits, or the medication, the child proves to be refractory to the current dosing strategy. You have to ask your provider, what are your next 3 steps? If this dose of this medication doesn't work, what will you do next? And it sounds like a crass question, but the truth of the matter is these aren't antibiotics. Right? It's not like you take a dose and it takes away the infection. ADHD doesn't go away with the medication. It's just improved. The impairment is addressed and the child is able to move forward in their life and experience some success. So you need to ask the question, what will you do, provider, when this medication ceases to work, or if the initial dosing strategy is ineffective? If your provider cannot give you 3 steps ahead, okay, if they can't articulate 3 steps ahead, that's not a good sign. All right. Because I promise you, 3 steps ahead is where you're going to be very, very soon. ADHD management strategies can be nuanced, can be complicated, and they demand a prescriber who has a level of experience that knows what to expect from medications and when to switch strategies. A good chess player wins not because they know the next smart move, but because they can anticipate the next several smart moves. Does your provider know what's going to happen 3 steps ahead if the current strategy doesn't work? Number 9, what are the costs of these medications, Dr. Noble? Well, listen, here's the good news. If your child's over the age of 6, it's very likely that your insurance is going to cover these medications if you have state insurance. If your child's under the age of 6, it's also possible that you'll get good coverage for these medications, even as low as the age of 4. So your out-of-pocket expense might be minimal, but it does depend on what kind of insurance you have. So I don't know anything about your co-pays. I don't know anything about any of that. But as a general rule, if you're strapped for cash and you got insurance that won't pay for these medications, listen to what I'm about to tell you, okay? It doesn't mean that your child can't receive treatment. It doesn't mean they can't receive treatment that's going to be remarkably beneficial, but it does mean that the treatment might be a little bit annoying, okay? Because drug companies, as a general rule, the more boutique and convenient the medication is, the more expensive it's going to be. So if you have to pay out of pocket, you got no insurance, or your insurance says, no way, Jose, here's what you're going to do. You just ask your provider to send in a prescription for short-acting methylphenidate, which is Ritalin. This is a medicine in some form has been around since the 40s, 50s, 60s, and it's safe, it's effective, but it is annoying because you got to take it in pill form several times a day. But the good news is about this is that if you pay it out of pocket and you're getting short-acting Ritalin, your out-of-pocket expense is going to be less than $20. In general, if it's more than that, you're getting ripped off, okay? I mean, $12, $15, maybe even cheaper than that. Now, I know that's still a big chunk of change. I'm not trying to minimize that, but please know that that's what you can expect to spend on the low end. Even if every insurance carrier that you're a part of says no way, you can still get treatment, but you're going to give a short-acting methylphenidate paying cash 2 or 3 times a day. And I promise you, it will still work just as well. It's just a little bit more annoying. Number 10. Are these medications easy to find? Spoiler alert, no. I don't know what happened, some kind of supply chain thing. Ever since COVID, these medications have been dramatically difficult to locate. It doesn't matter if you go to Walgreens or Walmart or Costco or any of the ones, they're all hard to find. And so what my point here is that you have to be patient. I know you've been patient. You've waited to see a provider. Now you're watching this video and thinking, well, maybe I need to find a new provider. Well, maybe you do, because ADHD can be kind of a lifelong thing. That doesn't mean that you have to treat it lifelong, but it's not going away. These medications don't cure ADHD. They help your child navigate ADHD, okay? So understand that you have to be patient when seeking to access these medications. When your provider sends in the prescription, don't drive to Walgreens and sit there and think they're going to have it. They probably won't. Get the app, let them text you. It could be 3 to 5 days. It could be 2 weeks, depending on your part of the country. We have significant medication shortages. But the other thing to understand is that if you're running out, you need to be proactive. Talk to your provider, talk to the pharmacist, let them know that you will be filling a script soon. If there's any way that they can pre-order things, depending on how they receive their medications, it's good for you to be clear and concise in your communication. Don't call your provider's clinic on Friday afternoon and say, oh no, we're going on vacation to Florida and he's out of Ritalin and we need you to send a script right now. I love you, I care for you, you're screwed. So these medications are difficult to find and you have to plan accordingly. Listen, I hope that this has been helpful. This video is for parents and families who are raising children with ADHD or disabilities or neurodevelopmental disorders. If you want to go deeper, you want to learn about workshops and things that we can do together, you want to go further, faster with me to expedite care and optimize outcomes, visit me on the web at www.drnatenoble.com and let's do this together. I'll see you in the next video.